are at the offices of Dr. Angelo Goose. Good morning today. I'm super excited because today we're going to be receiving a wealth of information by Dr. Angelo Goose here. We're super excited because we're creating awareness and educating members of the community. Dr. Goose's patients, myself included, we're here to learn all about quality life after prostate cancer treatments. So Dr. Angelo Goose, what do you have in store for us today and why?
Well, it's a great opportunity. I'm very super excited to have some of my former patients return here in my office today, and also some prospective patients or other individuals from the community who made it to the support group, which we're actually starting the support group, to help them understand how to manage what we call side effects related to prostate cancer treatment. Because many men will develop prostate cancer, and numerous of them will undergo treatment, and many of those who undergo treatment for prostate cancer will develop side effects, which we'll talk about a lot this morning. And one of the most common side effects, Liz, as you know, is the control of the bladder, urinary leakage problem, bladder control problem, which can result from prostate cancer treatment, and also erection problem, and that can affect their quality of life, and all the libido issues and sexual problems that can occur from prostate cancer treatment.
Great.
So this is what we're going to talk about, and hopefully we will have an opportunity to hear firsthand from patients who actually, and many of them my own patients, who actually went through this. They got prostate cancer, they were treated for prostate cancer, they've developed sequelae as a result of the prostate cancer, they've been treated, those sequelae, many of them have resolved, have improved, and many of them will testify, I believe, also how they found out about me as a reconstructive surgeon, as somebody who specifically deals with treating sequelae after prostate cancer treatment. This is truly a historical event for this community because, as you may know, many individuals suffer from prostate cancer and have to go through treatments, various treatment options. And obviously, the priority is to get rid of the cancer so you can survive. But often there are sequelae from prostate cancer treatment that really affect the quality of life of the patients. And I felt that many of my patients did not have a support group, a support environment, in order for them to know what are their options and how they can actually improve their quality of life after prostate cancer treatment. And the main prostate cancer treatments, as all of you know, include removal of the prostate, which is also called the radical prostatectomy by various techniques, either open procedures or using the robot prostate to remove the prostate, and radiation using multiple modalities such as external beam radiation or insertion of seeds into the prostate, or cryotherapy, meaning freezing the prostate, or a combination of all these type of treatments. And often these treatments, unfortunately, are plagued with adverse side effects for the medications. But I felt that it was important for these patients to have a friendly environment that they can gather on a regular basis in order to exchange ideas, to find out new information, to kind of share with each other actually how they dealt with this. So we'll have an opportunity during the session today, during the meeting, to kind of exchange personal experiences. If anyone wants to share it, everything here is voluntary.
Doc, I know you mentioned these devices, right? And you said, and this is for my own education, are these devices inside? You said it's inside the patient. Nothing is coming out, right? This is all like nobody would know, really?
No, if you would be naked, no one would know you have it on unless they purposely examine you. And not only examine you, they know what they're feeling for. They would not know you have it.
Because you said at some point you pump something or whatnot, but it's all inside, internal.
It's all inside. Yeah.
Okay, that was my question. Just
Some
curious.
of you may have this and want to talk about it, but that's fine.
Okay. Any other questions?
I have both. I have an implant, and I also have the artificial sphincter. And I was going through a number of pads a day. A friend of mine was going through many more, and we talked about it. And actually, he recommended me to come here. I was not having a quality of life. I was I wouldn't say I was getting depressed about it, but every time I turned around, I had to change a pad, or I lifted something. I had to, I peed. I like to go bowling. I couldn't pick up a bowling ball because the exertion. I would pee, and the pad sometimes wasn't enough. So any kind of work or anything else around the house, and then of course my evenings and sleeping was not a quality of sleep because I had to. I was constantly wet. So when I came here, and actually we talked about having this artificial sphincter, and when it was activated, I had my first evening of sleeping and waking up dry. And actually for that thing alone, I was very excited. I was excited to wake up without a pad. I was excited to pick up and go to even to take a bag of garbage out and lift something off the floor, like my shoes or something, and not leak. And then for my quality of life, certainly with my wife and other people, I don't really mean to be too funny on this, but I was able to wear tan pants again. Because if you wear light-colored pants, you leak. It shows through. And when you urinate, you can always catch it. So you're wearing a lot of dark clothes, a lot of dungarees, a lot of jeans. Well, as you can see, I've got tan pants on today because I have an artificial sphincter that absolutely captures it and holds it until I'm able to go. Thank you, Dr. Goose.
Well, great. It's been really an honor to be able to help people like that. I'm really humbled by this testimony.
Yes, first of all, when are we having lunch? My statements are consistent with this gentleman, and I was totally miserable wearing I have the artificial sphincter, and it just changed my life. I can't thank you, Dr. Goose, enough. I've sung your praises everywhere to everyone, and it's just remarkable that how much enjoyment I get out of life now. And I was very active before, and I started having this issue, and in fact, with the implant of the artificial sphincter, I just feel like life's worth living, and it's also because of you. I really thank you. I have some pain in my right groin and my right pelvic area, which I'm trying to resolve, and I think that perhaps it's from the radiation, because when I get up in the morning and walk, I don't feel uncomfortable, but as the day goes on, I feel more pain and more difficulty. Sometimes it interferes with my walking just because of the pain. But anyway, I'm working on that with Mary Leah, and hopefully I will get that resolved. But I can't thank you enough, and I rave about the artificial implant. I mean, it's an incredible device. I urge anyone that needs it to get it.